I gave the introductory plenary lecture yesterday at the meeting, and I was asked to discuss how immunotherapy for melanoma has changed over the years and where the revolution was and where the evolution is. And I think it was clear that the revolution in the immunotherapy of melanoma is the fact that we can now see what we call a tail on the curve of survival. That is, for the first time, we have patients who have long-term survival in melanoma with the use of PD-1 blockade, Ipilimumab with Nivolumab, and other combinations. We now have patients who have long-term survival, and some of them may be cured. So the revolution is that it is now possible to cure patients with melanoma. And the discussion about cure is something we never used to have in the past. 20 years ago, even 10 or 15 years ago, the median survival for melanoma patients was less than a year. The one-year survival was maybe 35%. Things have radically changed in the last few years with all the new drug approvals in the US and in the EU since 2011. We now have 70+% one-year survival, so we've doubled that. The median survivals are now tripled from what they were 10 years ago. So things have really changed a lot in our field. What's evolved and what is the evolution is understanding we now have these unusual immune-related adverse events. We now see unusual kinetics of response. And what will be a bit of a revolution is the understanding that the reason why patients don't respond to these novel drugs is the fact that the tumor microenvironment is non-inflamed, or what we call a cold tumor microenvironment, and the understanding of how to convert a cold tumor microenvironment to a warm tumor microenvironment will be the next revolution, and that I think will help us to increase yet again the tail on the curve and the potential for curing patients with melanoma.